So our lovely assistants here are getting our dog prepped for a neuter. And he's been pre-medicated already, meaning that he's been given a little bit of a sedative just to settle him down. And right now, what Gretchen is doing is what's called induction. She's giving him a combination of medications to get him sleepy and groggy enough so that a breathing tube can be put down his throat, and then he'll be put on a machine that delivers a combination of oxygen and then an anesthetic agent. And so she's just kind of testing his stage of relaxation here to get him to the point where she can comfortably get the tube in, which she'll do in a few seconds here. And so you just see how groggy he's gotten with that, and obviously the purpose of the anesthesia is to allow us to do surgery, but it's also to make the procedure non-painful for the pet. We have to be aware of pain and pain control all the time, and a lot of these medications that we're given, the pre-medication and the induction agents, will accompany that. Plus he'll get additional pain medication prior to waking up. So now they'll flip him around, and Sharon's lubricating his eyes because a lot of animals under anesthesia do not blink. And so if the eyes are not lubricated, then they tend to dry out. So we'll put him on his back. And then we'll clip him. And then they'll scrub him down with a sterile disinfectant so that the surgery site is clean. And then he'll be ready to neuter, and the actual surgery itself will probably only take 5 to 8 minutes. It's pretty quick once you get going. And of course the purpose of this is a dog like this could be out reproducing at will and creating unwanted litters and endless amounts of puppies, and that's obviously not what we want from a Humane Society standpoint. So the surgical sterilization will obviously prevent that from occurring, plus behavior-wise it'll probably make him a more acceptable pet for somebody. The intact males are so prone to a lot of urine marking, leg lifting, and roaming and behaviors that just aren't acceptable. So the neutering tends to really settle that down a lot and resolve those issues.
Is there also a health benefit?
Well, the big concern with males is, of course, as they get older, they're susceptible to testicular tumors and prostatic disease, and the neutering really helps to prevent that. You remove the stimulus, the testosterone, and you can prevent a lot of that. Plus, you won't develop male pattern baldness then. One of the things about the Humane Society surgery is there's a certain need for efficiency, so we tend to move fairly quickly, and a lot of times when we're doing this, they'll be prepping another pet while I'm doing a surgery so that they can just rotate one over as soon as I'm finished, and we'll keep them going. I think our record for a morning of surgery is sitting at about 52. None of us could work for 3 days after that because we were so exhausted, but we got 52 done in the morning. So now we'll just get our instruments opened up here and be ready to go. So what we want to do is we want to drape off our surgery site. Small hole here for where my actual surgery will be done. We'll lay that over our dog. And we're ready to go. And what we're doing here, the full castration involves removing both of the testicles. This isn't like a vasectomy like you'd envision in people. We want to remove the hormonal stimulus, the testosterone. So in order to do that, we have to take the testicles out. And so I just make one incision and then just gently get down to the testicle. And then once I'm there, just exteriorize it. And like anything, it's got a healthy blood supply, so I need to ligate the blood vessels to prevent any excessive bleeding. And that's relatively simple. We just put clamps across the vessels. We use a dissolvable suture material, so there's no need to go back in and take anything out. And we'll just get around this and get some good knots around it. And that beeping here in the background is an anesthetic monitor that's monitoring his heartbeat and respirations and all, and so you just kind of get in tune to that as you're doing these surgeries to listen and make sure that everything is stable. So there's one. We just check for any bleeding, which is very minimal now. And we'll exteriorize the other testicle, and same thing. We have had requests in the past just to do vasectomies on dogs, kind of a rare request, but we do it on a rare occasion. Interesting enough, for the people who are into cosmetics, they actually make testicular implants that can be put in dogs afterwards, so they look like they're intact, but are in fact neutered. So how's he doing?
It's good, it's just that the probe wasn't picking up.
Okay. So Gretchen's just kind of listening with the stethoscope, making sure that everything is good there. And that's really it. That is a neuter. And all I have to do is close the incision down with a couple sutures, and then we have adoptable pets here. So the spay is much more involved, because the spay is an abdominal procedure. This is fairly superficial. As you can see, it's fairly quick.
Can you still run into complications, though, with a neuter?
You know, the biggest complication is a dog that'll lick its incision post-operatively. A lot of dogs will traumatize themselves pretty badly, and usually it's not a big deal, and that's when you bring the old cone collar out, the funnel, and put it on them and make them wear it for a few days. Pretty low complication rate with a neuter. You know, not like a spay.
And anesthesia-wise?
Well, there's always a risk of anesthesia, but you know what we have these days is so safe with our pre-meds and injectables and kind of top-of-the-line inhalation agents that, boy, to have an anesthetic complication is just really rare. I think everyone is a little afraid of anesthesia, but we just, like I say, we just don't have complications very frequently. And this guy will be waking up here shortly, so you're talking about him being out for all total, probably less than 20 minutes.
How long have you been a veterinarian?
Well, a long time, 23 years. So I graduated in 1987 from Michigan State. So it's been a while. I didn't start off in small animal initially. I started off in large animal, and then gravitated towards the cat and dog medicine after a couple of years of getting kicked around by cows. Decided I wouldn't grow old doing that for a living, and plus I enjoyed medicine and surgery more. and I just didn't have the opportunities working with a large animal to do that. So, and I like the emotions of dealing with the small animals. I like the pet aspect of it, and the companionship and whatnot. So it just was.
And what brought you to the Humane Society here?
Well, up in New London, where I practice, we actually started to do our own rescue work through the clinic. So we act as the local shelter for the city of New London, and since then we started taking animals from surrounding townships and whatnot, and so we essentially run our own shelter within the confines of the clinic. And it's very hard for us to adopt all of our animals out in a smaller community, and so what happened is I had just been talking to, with someone here at the shelter a number of years ago, and we were talking about the issues of adoption, and next thing you know, I found myself coming down here to volunteer to spay and neuter, and then they also help us with some adoptions as well. So it kind of ends up being a mutually beneficial
It's a win-win
relationship.
situation
Yep.
for all of
Yep.
us. Well, we really
Yeah.
appreciate the
Yeah.
time that you give. It really
Yeah.
is, it makes a big difference for the animals.
Well, and you know, one of the things that I think you have to have a passion for it, and I've always had a passion for the strays. All my pets are strays, and one of the things that I feel bad about is veterinary medicine is advancing rapidly in terms of what we can do with pets, and yet we can't reduce our euthanasia rates enough, and to me that's really sad. And this is the kind of thing we need to do to reduce the euthanasias and get pets in homes. So to me it's a worthwhile cause. Yeah, I enjoy it. It's very rewarding.
And hopefully now people can see that, you know, while it is a surgery, it's something relatively quick, and over, you know, over the long term, it's a good thing to have your pet spayed or neutered.
Yeah, certainly. And you know, without neutering, I don't know what chance this dog would really have of really having a nice lifestyle. He'd probably end up being a stray endless times if he weren't neutered. So.
Spending all his time trying to find a girlfriend,
right? Roaming around and doing inappropriate things. Yeah. And like I say, just one intact dog can do so much damage in terms of propagating the population of unwanted animals. It's just unbelievable. So when you do a simple neuter like this, it just prevents so many unwanted pets down the line that it just does a lot of good.